The surging contagion continues to ravage the weak country's health sector. The recent surge now seeing ICUs in different hospitals countrywide being overwhelmed with high number of patients.
At the moment, we are slowly coming to a point where oxygen supplies are being threatened by a number of issues.
The oxygen generating companies are overwhelmed with the demand and currently cannot meet the country's demand. Ambulances are camping at the oxygen production sites to wait for even the last drop to save the patients.
The crisis that has led to insufficiency in oxygen gas cylinders in virtually all hospitals. The insufficiencies that has led the Ministry of Health owing to the pressure of the challenge of inadequate gas cylinders as more Kenyans contract the disease in the third wave.
We have got about 20,000 oxygen cylinders that are out there in people's homes, that are in hospitals and other institutions. Now, these cylinders are required back to the industry immediately. Each cylinder costs about 40,000 shillings, and therefore you can do the maths. The cylinders out there, to replace them would require a substantial amount of money.
However, Association of Medical Engineering of Kenya has blamed the ministry for grappling to put its house in order 1 year into the pandemic.
They tell you the ICU is full. It is full with what? It is full with mangoes or just tomatoes. It's supposed to be fully equipped, even if it gets full, so that those patients that comes in are healed faster. Then there's a rotation. So if you get a patient there in the ICU sharing 2 ventilators at intervals, then what are you trying to tell us?
We have different hospitals. We have Aga Khan, we have Mpisha, we have Avenue. All the hospitals, we are calling across each other to support each other with oxygen. We borrow. We have reached an extent of borrowing oxygen from each other. Due to the 24/7 usage of equipment, the rate of breakdown of these equipments are also so high. We have had to stretch out to go to an extent of working day and night with this demand.
Currently, there is a high demand for oxygen in hospitals, but the country is grappling with poor infrastructure to manufacture oxygen in about 70 oxygen plants. Most of the factories have broken down and are unable to meet the new demand for oxygen.
We can't get spare parts for some of the plants that were built a couple of years ago, essentially because they came from sources that are suspect. And if I give an example, the oxygen plant in Kenyatta National Hospital was, for example, supplied by the then Czechoslovakian Republic. The country itself does not even exist. So how can they even begin to repair the Kenyatta National Hospital plant?
Meanwhile, patients at high-end hospital will have to part with a huge sum of money to be admitted to a COVID-19 bed. The medical engineers say Nairobi Hospital is charging between 130,000 to 300,000 shillings, the covers for ICU costs for the COVID-19 patients, while Nairobi West Hospital's ICU parts with a sum of 300,000 Kenya shillings that is required as deposit. Well, as the country stumbles in the ICU, on the other end, the oxygen crisis is slowly overwhelming the health sector. And yet, if little is done, well, the country could likely fall into a fourth wave of the COVID-19 crisis. Milliah, Kisienya for Abru TV.